what is wrong with my neck or my low back that's causing this pain that I'm having? What do I need to do to address this problem and get better? What do I need to do so this problem doesn't keep happening over and over again? I'm Klassen. I'm a physical therapist certified in the McKenzie Institute, and my job is to answer those three questions. We all take our body parts for granted when they're not hurting. And when they do hurt, it's extremely intrusive. You can't sleep, you can't focus, you can't move. The good news is that the vast majority of these issues, they're resolvable. They don't need injections, they don't need surgery, they don't need a host of medications. They need good quality care where they understand what's contributing and where the countering movements are that they can use to resolve the problem. We've all woken up with a stiff back or a stiff neck, and we work through it, in a matter of a few days. And when it starts going maybe over 4, 5, 6 days, and it's just not improving, it's time to take action. The quicker we can get to a problem, usually the easier it is to resolve. And it's so easy to put it off week after week after week, and then it just gets harder to work with for both the patient and the therapist. When a person comes in, my priority is to diagnose exactly what the root cause of the problem is. Many issues pertain to mobility issues in the neck, so we have to use the right type of movement to counter or correct the mobility issue. So we're looking at very directionally specific exercises. Some issues pertain more to strength or chronic pain, headaches. So those all entail different types of intervention. Obviously, we can have an injury that occurs suddenly, but more often than not, it's accumulated postural stress. And the solution ends up being recognizing what those habits are that we need to correct and learning how to reverse it with movement so that we can see progress and not only get rid of the pain, but I think the more important part is staying rid of the problem. One of the more common elements that I emphasize with people is paying attention to the relative position of their head over their shoulders. When we tip our head forward, it adds to the stress on the neck significantly. So it's the reversal, bringing the head back, that often where we start, and then there's progressions from there that are often necessary to fully correct a problem. Now, when it comes to dealing with a specific type of problem in the neck, then it's very important that we are specific in regard to how we treat it, because most neck issues are extremely picky. One movement will make it worse, one movement will make it better, and a whole host of other movements will be neutral. They don't do anything. In regard to general strengthening or posture, it's really not a specific exercise. It's more an awareness and that you stay physically active. That helps keep our muscles awake, and most people find that, hey, it's easier to sit up straight and stand up straight when I'm regularly exercising, no matter what that exercise program is. So move, stay active, stay physically fit. All of those things end up being very important parts of just maintaining a healthy lifestyle, helps us maintain a healthy spine as well.